Good morning, students. Myself, Sapna Chaudhar, working as an assistant professor at IIMT College of Pharmacy. Today, we are going to discuss about the anti-diabetic agents. These anti-diabetic agents are simply called as the drugs used in the treatment of diabetes. So, basically, what is diabetes? We are going to discuss about that first. Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. That is, insulin is a hormone that regulates the blood glucose level. Whenever that insulin level is decreases or something like it is not functioning properly, the condition arises that is increase in your blood glucose level is simply called as diabetes. There are two types of diabetes. Type 1, insulin dependent diabetes mellitus, and type 2, non-insulin dependent diabetes mellitus. In case of type 1 diabetes, it is also called as insulin dependent diabetes, or it is characterized by the deficient insulin production and requires daily administration of insulin. When in case of type 2 diabetes mellitus, it can be treated by the antidiabetic drugs. It affects how your body uses the sugar, that is your glucose, for the energy. It stops the body from using insulin properly. Whenever there is a sufficient amount of insulin, but your body does not support to use that insulin properly, which can be lead to high level of blood glucose. And it is if it is not treated, the diabetes anti-diabetic drugs are used for the treatment of type 2 diabetes mellitus. So what is insulin? Insulin is a protein composed of two chains and a chain, it composed of two chains. Total 51 amino acids are included in the chain of insulin. That is, first chain is composed of 21 amino acids and second chain is composed of 30 amino acids. So total there are 51 amino acids present in the structure of insulin. That A and B chain is connected by disulfide bridges. That is, it is shown in the figure. That is, two amino acids chain are connected each other by two sulfur atoms. That is, disulfide bridge is present between these two chains. Then moving towards the next, insulin is A chain is various amino acids are present in the A chain. In case of B chain, that is total 30 amino acids are present. 30 amino acids are present. So there is what is the insulin preparations? Next, what are the different insulin preparations which are used in the treatment? First is regular insulin, then insulin lente, and intermediate acting insulin, regular or short acting insulin, long acting insulin, and ultra short acting insulin. In case of regular acting insulin, various examples are there for the regular insulin, like insulin lente or lispro insulin. These are the some basic examples of regular insulin. So depending on their duration of action, various classes of insulin are there. Then classification of antidiabetic agents. There are total 5 classes of antidiabetic agents. First is your sulfonylurea. The star marking drugs present in sulfonylurea category drugs is tolbutamide. Other examples are chlorpropamide, glipizide, glimepiride, and glibenclamide. Next class is biguanide. Example is metformin. Then thiazolidine example rosiglitazone, pioglitazone. Next is glucosidase inhibitor. Example acarbose and voglibose. So first category is your sulfonylurea category drugs. First is tolbutamide drug. The basic mechanism of action which included in the sulfonylurea category drug is they are act by blocking the potassium channels. So these potassium channels are potassium channel receptors. Sulfonylurea drugs are bind to the sulfonylurea receptors, and then sulfonylurea receptors leads to blockage of potassium channel. That blockage of potassium channel leads to open the voltage gated calcium channel. So there is various positive ions are present in the single. Various positive ions are present in the beta cells where the insulin is produced. So it leads to increase in the level of insulin. So this is the basic mechanism which included in the sulfonylurea category drug. It is also explained in this slide also. Sulfonylurea bind and close the ADP sensitive potassium channel. It binds to sulfonylurea receptors and leads to closure of potassium channel on the cell membrane of beta pancreatic cells, which depolarizes the cell by preventing potassium from exiting. This depolarization opens the voltage-gated calcium channels, and the rise in intracellular positive ions leads to increased fusion of insulin granules with the cell membrane and therefore increased in the secretion of the mature insulin. So this is the basic mechanism which is included in this category, sulfonylurea receptors. Then the sulfonylurea example is tolbutamide. The synthesis of tolbutamide involves the addition of reaction of para-toluene sulfonamide and butyl isocyanate in the presence of triethylamine and tetrahydrofuran. Then triethylamine and tetrahydrofuran, when this reacted with it produces the intermediate product and the last stage is synthesis of tolbutamide. This is the basic structure which included in the SAR of sulfonylurea, or the various drugs are depending on this basic structure. Little modifications are there. So it produces the various structures of sulfonylurea, which will be discussed later. So here is this SAR of sulfonylureas. The benzene ring should be contain a substituent, preferably in the para position, that is denoted by R group. He substituent such there are substitutions like methyl group, acetyl, amino, chloro, bromo, trifluoromethyl, and diaminomethyl were found to enhance the anti-hyperglycemic activity. If the para position substituted by the groups like methyl acetyl or amino, such a groups increases the activity, antidiabetic activity of the compound. When the para position of benzene is substituted with aryl carboxymidoyl group, that is second generation sulfonylurea drugs such as glibenclamide is denoted by such a substitutions, the activity has found to be enhanced further. That is why the second generation drugs are found when the para position is substituted by other groups rather than methyl or acetyl groups. The second generation sulfonylurea will found, and it like example is glibenclamide. Next, the size of the group is attached to the terminal nitrogen atom is crucial. That is, the substitution at the terminal nitrogen atom is very essential for the activity. The group should also impart the lipophilicity, that is your lipid solubility, to the compound. L-methyl and ethyl substituents that show no activity if that terminal nitrogen is substituted by ethyl or methyl substitution, it shows the decrease in activity or it shows no activity. Whereas N-propyl and higher homologous were found to be active, and the activity is lost when N substituents contain 12 or more carbon atom. If the terminal nitrogen atom is substituted by 12 or more carbon atom, the activity decreases, and if it is substituted by N-methyl or ethyl group, the activity is there is no activity. Next mechanism, it was discussed earlier, like it acts by blocking the potassium channel by attach sulfonylurea category drugs are attached to the sulfonylurea receptors, and there is a blockage of potassium channels. It leads to increase in voltage gated calcium channel voltage gated calcium ions by opening the voltage gated calcium channels, and it finally leads to increase in the secretion of insulin. These are some drugs which are included in sulfonylurea category like chlorpropamide, glimepiride, glibenclamide, and glipizide. Rather, other than tolbutamide category, it also tolbutamide drug. It also includes the chlorpropamide, glimepiride, glibenclamide, and glipizide. Next class of antidiabetic agents contains biguanide biguanides. Example of biguanide is metformin, It mainly used in the type 2 diabetes and is considered to increasing insulin sensitivity in vivo, resulting in reduced plasma glucose concentration, increased in glucose uptake, and decreased gluconeogenesis. Gluconeogenesis is simply the conversion of glucose glycogen to glucose. When that glycogen is doesn't converted into the glucose, ultimately the blood glucose level is decreased, and it also increased the glucose uptake by cells. So basic specific mechanism of metformin is not known, but these are the mechanism which shown by metformin drug. Next, uses of metformin. Metformin is used in the various conditions like type 2 diabetes, then polycystic ovarian syndrome, then gastric cancer, when the diabetes arises in the pregnancy, and next in Alzheimer's disease. Next category of the anti-diabetic drugs is thiazolidinedione. There are two drugs which included in this category. First one is rosiglitazone, next is pioglitazone. Thiazolidinedione do not stimulate the insulin secretion. They act by improving insulin sensitivity via activation of the nuclear receptor peroxisome proliferator activated receptors, simply called as PPART. These PPART receptors are responsible for the synthesis of production of glucose. So it increases the improving the insulin sensitivity. That is, when the insulin is activated, the insulin is decreases the level of glucose. So that this thiazolidine category of drugs simply activated the PPART receptors. These are the some structures of rosiglitazone and pioglitazone. Uses of rosiglitazone. Diabetes drug thiazolidinedione type, also called as glitazones. It indicated by the name of the drug rosiglitazone and pioglitazone, used along with a proper diet and exercise program to control high glucose level in patients with the type 2 diabetes mellitus, or we can simply call it as it is used in the treatment of type 2 diabetes. It works by helping or restore your body proper response to insulin, thereby lowering your blood glucose level. It utilizes the insulin in a proper manner. That's why your blood glucose level is decreases or lowers. Then controlling high blood glucose sugar helps to prevent kidney damage, blindness, nerve problem, loss of limbs, and sexual function problems. Proper control of diabetes may also lessen your risk for a heart attack or stroke. Next category of drug is miglitide. Mechanism of action of miglitide is similar as that of sulfonylurea category drugs, but these are less potent than your sulfonylurea category of drug. Mechanism: miglitide are based on the sulfonylurea moiety of glimepiride, that is your second generation anti-diabetic sulfonylurea drug called miglitide. They bind to the sulfonylurea 1 receptors on the beta cells, although with lower affinity than sulfonylureas, and stimulate insulin release in the same way. That is, it binds to the sulfonylurea receptor, then leads to a blockage of potassium channel. That potassium channel leads to opens the calcium ions, calcium channels, and when the voltage gated calcium ions are calcium channels are open, that stimulate the entry of calcium ions, and that increasing the positive ions in the beta cells depolarizes the cell, and which increases the insulin synthesis. Then uses of repaglinide. Repaglinide and nataglinide are the example of miglitide category of drug. Repaglinide is used together with the diet and exercise to treat blood glucose level in the patients with type 2 diabetes. Repaglinide work by causing pancreas to release more insulin in the bloodstream, and this medicine does not help the patients who have insulin dependent or type 1. So specific repaglinide is used in the type 2 diabetes. This is the structure of nataglinide drug, used together with the diet and exercise to control blood sugar level in patients with type 2 diabetes. It works by causing your pancreas to release more insulin into the bloodstream, and this medication does not used in the type 1 diabetes. Next category of drug is glucosidase inhibitor, simply called as alpha-glucosidase inhibitors, are the anti-hyperglycemic agents that lowers the blood glucose by delaying the digestion and absorption of the complex carbohydrates. They are competitive inhibitors of the enzyme in the brush order of the enterocytes that create oligosaccharides that cleave oligosaccharides to monosaccharides. That glucosidase is the enzyme which helps to convert the larger form of the glucose into the smaller form, that is oligosaccharides converted into the monosaccharides, and that monosaccharides used by the cells. So blood glucose level will be increases. So our drug main purpose of the acarbose and voglibose, these are the examples of glucosidase inhibitors. So acarbose and voglibose inhibit the enzyme glucosidase. This inhibit the conversion of larger form into the smaller form. So the blood glucose level ultimately decreases. So that's all about today about the anti-diabetic agents. Thank you.